We take you now to the northwest, where health authorities say the Christiana Hospital fire in September was caused by human error. The MEC for Health Madoda Sambatha released a forensic report at a meeting held in Christiana this morning. The hospital was ravaged by fire just before the completion of a 100 million rand renovation project. For more on this, let's touch base with our reporter, Bafedile Moerane, who's been attending the press briefing this morning. A very good afternoon to you, Bafedile. What has come out from this briefing today?
Well, a long-awaited report there, Tammy, and having to indicate that the fire was a mistake. It was an accident, actually, by one of the contractors. The workers of the contract that was busy there renovating this particular hospital. It means that then the 100 million, it went down the drain, but the MEC is indicating that the contractor will have to take the responsibility of rebuilding that particular hospital, because when the fire happened, they were still on site. We understand that the first part of the project was done, and they were still on the second part, to finalize that particular 100 million renovations. So the MEC has outlined that they are also in a process of restoring services at Christiana Hospital, but it is still tricky, to say that how are they restoring services when the hospital, it is, the entire building, it is ravaged by fire. But he has rest assured the workers as well as the residents of Christiana here that he is going to restore services from today until April. All the workers that have been redeployed to other facilities in nearby areas, that includes Vryburg, Bloemhof, among others, and the local clinic, which he has indicated that it is now carrying the capacity of this particular hospital temporarily while they are still fixing this issue, this matter. So they've also received some donations for the equipment to be used, but we are also asking ourselves, as it's still not clear from them that where is this equipment going to be placed, Tammy. So it's still going to be a long journey for them. They are saying that the facility will be working in full force by the end of next year, which is 2021, around this time. But in April, they're saying that they will bring temporary structures there where residents will be getting services from that particular hospital, because right now it means that residents have to travel long distance, over 60 kilometers, to places like Vryburg, places like Bloemhof, to get services there. And we've had a number of community members in that particular meeting or press briefing earlier on complaining to say that, but you are not clear, MEC, as to how are you going to assist us temporarily, because you are saying that there are measures in place, but we are suffering as residents of Bloemhof, of Christiana rather, to get services, health services. We have to fend for ourselves to get those services.
So just for a matter of clarity, Bafedile, as it stands now, the Christiana Hospital is not accessible. The MEC has said by the end of next year it will be fully operational. But can those who need any sort of assistance go to the hospital? Are there going to be any temporary structures? Or is that site still very much a construction site? No interim measures have been put in place as we speak?
They cannot access any health facilities in that particular health services rather in that particular hospital. They have to go to the local clinic, which we understand last week when we were here, it is operating by 2 nurses, although the department and officials are saying that they have redeployed some of the workers from that particular hospital to that local clinic and other facilities which are in this jurisdiction. But it still remains a serious challenge. What they are saying, it is not what we are seeing on the ground. There are also some of them operating under tents, to administer vaccines, and which is a serious problem when it's raining like this morning. It was heavily raining, and they had to stop the operations because of that heavy rainfall. So they are saying that by April, all the workers that have been redeployed to other facilities, they will now be starting to work and on the temporary structure at the Christiana Hospital, which is now closed altogether. But we understand that those who are, working on the ambulance sector, they are operating from that particular building, bent building. They have also highlighted the challenge to the MEC during the press briefing to say that the MEC should attend to the matter by, fixing issues of toilets. They do not have access to toilets when they are at work, among others. And they have requested him to visit that particular facility to see how they are struggling on a daily basis when they have to come to work. So it's still going to take a long time to restore services in that particular hospital. They have admitted that at least they are hoping that by next year, around this time, the services will be back, will be operational in that particular hospital. But we also want to hear the side of the contractor there, because what we gather on the ground is that the contractor does not agree with the department. They even want to go to court, take the department to court to say that you cannot say that we must be responsible for the fire, as the forensic report stipulates. So we will try to get the contractor who was at that particular hospital with these renovations to hear the side of the story as to, are they agreeing with the department to carry the cost of rebuilding the hospital from scratch?
Another issue there, which you've just brought up a little bit earlier on, the issue of the liability. Did they talk about perhaps any sort of insurances being in place? Who's going to be responsible for the rebuilding of the hospital? You mentioned that the MEC says it is a human error and that the contractors are the ones that are responsible for, reconstructing the hospital because they are the ones that are in fault. Who is going to shoulder the financial responsibility of this project moving forward?
When I asked the MEC that particular question, he has indicated that the contractor probably he does have the insurance. So it means that the insurance will have to pay. Hence, I'm saying to you that we will have to call the contractor, when we're done here to hear their side of the story as to whether they do agree with the department to say that they have to carry the responsibility and rebuild the hospital from scratch. Because really a lot of money, it is gone here, 100 million. Imagine such a lot of money that was used, and just before, they could finish the renovations and then the fire ravaged that particular facility. So we'll have to get more details and more clarity from the contractor that whether they do agree, because what we gather on the ground, it is that the contractor wants to go to court. It does not agree with the department, but it clearly shows that it's going to take a very long time to restore services in that particular facility, and which means that residents here will struggle, because they are complaining. Earlier on in the morning, we spoke to one man, Andres Botma, who has indicated to us that they are struggling as residents of Christiana since, the ban of this particular hospital. And they're calling to government authorities to come down and come with mitigation plan, because that particular local clinic that they're indicating that it has now been used as an alternative, it also does not have capacity to assist the entire community of this particular place. Because remember, it's not only residents of Christiana that were getting services there, including also residents of Bloemhof, Herzogville, which is in the Free State side, as well as Yankemdorp, which is in the Northern Cape. They were also getting service from this particular facility.
Bafedile Moerane, thank you very much for that update. Ultimately, the community still in distress, not having use of that facility, and the financial implications and the impending court case. It certainly looks like this particular situation is far from being resolved. Thank you so much. That's Bafedile Moerane coming to us live from the Northwest provinces on the fire that basically burnt down the Christiana Hospital in the midst of a 100 million rand renovation project.